I'm Dr. Josephina Benincasa-Feingold, and this is Valley Health and Hyperbarics. The best way to explain hyperbaric oxygen therapy is by looking at our outside world. We are under a column of air. That's what keeps us on the planet. It keeps us on the ground. That column of air, of pressure on us, atmospheric pressure, determines how gases behave. So, for example, when we're at 1 atmosphere, we're on like sea level. If we go deep sea diving, that column of pressure is greater. This is why when you go deep sea diving, pressure increases. When we go mountain climbing, that column of air that exerts pressure, that column of pressure that is exerted on our bodies is smaller. What does that do? It determines how gases behave. First of all, a lot of people will refer to them as dives. That's because historically these machines were designed to treat the bends. We really couldn't put patients back in the water, so they designed these chambers to put somebody in and simulate the descent back to the pressure where they were, and then bringing them back up slowly. It really technically should be called a treatment, not a dive, because you're not in water, but the nomenclature has stuck. So gases behave in a certain way. At equilibrium, if you have gas above a liquid medium, particles of gas that are in constant motion will hit the surface and go into the liquid. At equilibrium, the amount of gas which is in the liquid medium depends on 3 things. Number 1, concentration. Number 2, temperature. And number 3, pressure. Concentration, it kind of makes sense that if instead of using 21% oxygen, I use 100%, there's going to be a lot more of those particles that hit the surface. So we have, if we could test, and we have been able to test, the amount of oxygen that's in that liquid at the time is going to be greater. The other one is temperature. Temperature, because there's movement of particles. So the higher the temperature, the faster particles move. And if they hit the surface, they're going to hit more times because they're moving faster. So there's more of a probability of those particles getting into the liquid medium. And then the last is pressure. We observe this all the time with carbonated drinks. CO2 is a gas. Now, if you open up the bottle, the bubbles all come up because you're releasing the pressure. If I put a piston on it, which is exactly how they make carbonated drinks, then what you're doing is you're forcing more of the gaseous particles into the liquid medium. And that triggers a cascade of events in the body. If we're using oxygen, we're using 21% oxygen, or we use 100% oxygen, the greater amount of gas that goes into the liquid medium is actually pressure. So what we're doing is, when we're going into a hyperbaric chamber, you are increasing the pressure, and therefore more gas that is in your lungs will go into your blood. That will trigger a whole cascade of events, including anti-inflammation. So we have, instead of taking an aspirin, a Tylenol, or an ibuprofen, this is a way of decreasing inflammation. It also causes healing. If you consider your body like a house, things come in, things go out. If that doesn't work, that things come in and things go out in a fluid manner, you're going to have things getting stuck, and that's inflammation. So under hyperbaric conditions, you have decrease in inflammation, and the things that come in are oxygen and nutrients because your perfusion improves. The things that go out because the perfusion improves are the toxic metabolites, the toxic products of metabolism. And these are the hyperbaric chambers that we use at Valley Health in Hyperbarics. These chambers, as you see, are made by Health, which is my favorite company. There are others now that have come to the market, but these are the ones that I use, and this is our center.